Hi, I'm Loretta Bush, President and CEO for Authority Health. Since it's still January, I'll start off by saying Happy New Year. And we promised you that in this upcoming year, we would be bringing you various different topics. And so today, I'm very excited to be talking about our teaching health center that rotates medical professionals in 4 disciplines. The other thing we're always proud to say is that our teaching health center for physicians is the 2nd largest teaching health center in the nation. The other thing that makes us very unique is that we offer several electives for our residents that they can choose from. And one of the electives that can be chosen is a 6-week rotation in the rural area of Kenya. I think you're going to be very excited to hear about it today and really get a feel for how our residents not only practice the best in traditional medical care, but also is very interested in resource-constrained areas, which may be rural, they may be urban, and in this case, it's in whole nother part of the world, learning really how to understand people, their patients, and the situations where they live, work, and play. So with that, 2 of our residents recently traveled to a very rural area of Kenya, and I have one of those residents here with me today. So Dr. Alyssa Motzel, did I pronounce your last name right?
Motzel, yep.
Motzel, she went with another residence for 6 weeks, and Dr. Motzel is here today to tell us about that experience. Welcome.
Thank you so much for having me.
So glad to have you here.
It's fantastic to be here.
I've really been looking forward to this conversation.
Me as well.
So even before you went to Kenya, your desire to be in this particular residency really was a part of that decision for the type of medicine that you wanted to practice going forward.
Absolutely.
So tell us, what did you see in our residency program that fit your practice goals?
Yeah, that's such a great question. And coincidentally, around match time, I know in the next few weeks, a bunch of medical students will be putting their preferences. So just 3 years ago, I was in their position when making the decision for residency. I think that medical schools kind of set you up to keep your mind open, which I appreciated. One of the things that drew me towards Authority Health was their commitment, of course, to the underserved population, but in a whole different way than a typical hospital setting. We have the opportunity to rotate through federally qualified health centers, obviously, as you know. And I think that spoke to what kind of not only physician I wanted to be, what kind of person I wanted to be.
For sure.
It's the common phrase is meet people where they are, and I think that Authority Health takes that to a whole nother level. Residency training can be such a delicate time in in a personal and career part of your journey, and I think to me I wanted to challenge myself to be a part of something very big, right? It's throughout the whole community of Detroit and beyond, and I think I wanted to just be one piece in this whole wheel that can make a community better by not just stepping my toes in, but really diving in.
Absolutely.
Yeah.
Yeah. Well, and I assume we're meeting your needs.
Oh, more than I could have ever imagined. I think that there are aspects, and I love talking to medical students now about Authority Health because you can only tell so much on a website, you can only look so much stuff up online, and today in today's virtual age, it's difficult to really get a feel for all that Authority Health does and how we touch people. But now that I've been a part of it, I can see all the different avenues and kind of our presence where we're not always making it a marketing thing, but it's truly that we're involved in people's families and in people's journeys, and I think that's what's important.
We're actually doing it. All right, so tell me about the rotation to Kenya. How long was it? Where were you? And what all was involved in that rotation?
Yeah, gosh, it was less than a year ago. It's still fresh in my mind like it was yesterday. So the rotation itself lasted about 6 to 6.5 weeks. I had the opportunity to be in Kenya for about 8 weeks. So I think the most common place that people are aware of is Nairobi. It's typically a connecting flight for different parts of Europe and Asia. It's a beautiful city, of course. So we landed in Nairobi, and then we took a train about 2.5 to 3 hours. It's about a 5-hour drive out to one of the most rural towns in Kenya called Mutomo. This area is one of the poorest populations. It's one of the poorest towns, and it's extremely under-resourced, but there they have a medical mission hospital. And through our partnership with CMMB, the Catholic Medical Mission Board, we are able to have volunteers come, be a part of the medical mission hospital, and then be a part of the outreach community program with CMMB. So at CMMB, we're able to work in Mutomo, and then we actually go even further rural and meet people where they are literally within their houses, their homes, which look very different, obviously, on that part of the world.
Yeah. So were there any language challenges, especially when you got out way into the rural areas? I assume people were speaking their, tribal or native languages.
Absolutely. I think I had the naivety before to try to, brush up on some Swahili, or as they call it, Kiswahili. But to your point, there's 47 tribes in Kenya, and the part of Mutomo that I was specifically in, it's the Kikamba tribe. So they speak Kamba, and there were people that didn't even speak Kiswahili or Swahili. They only spoke their tribal language. I think one of my favorite parts, though, was connecting with them through learning their language, because they felt if I cared enough to even just speak to them in their native tongue, then I was kind of there for more than just show. I really wanted to connect with them more, and that was really fun. It was difficult. It's a whole new language. It's, we're able to hear Spanish and some French here, of course, and Arabic, but it's a language that I never even had the chance to learn before. And so learning it through people was my favorite way to learn a language, for sure.
That's really wonderful, and especially when you're, going to be talking about medical issues and everything, how much more personalized could it have been for you to try to speak their own language? You can tell you're very comfortable with the words and describing the population and who they were. So I understand that you treated over 400 children and provided 100 hours of community service and education for nurses and physicians. So we certainly want to hear about that.
So I think sometimes when you put a number on paper, it seems crazy to look back, because while I was there, I wasn't really thinking about the numbers. I was just more so thinking about the friends I was making, both in patients and the workers that I worked with. But part of their hospital, it's all connected. As you can assume, there's no windows, there's no doors. It's all kind of open to the air. It's a very hot and humid environment. Kind of an interesting fact is that when it rains, the beginning of our trip was during the rainy season, and then the end of our trip, it was the hot, humid time. When it rains, people actually leave the hospital, even if they are sick, because they want to collect the rain for their homes for a bunch of purposes. There's a lot of lack of water in the area. So, but when there was a lot of people in the hospital, as there were many times, my co-resident at the time, Dr. Harris-Kober, we were in charge basically of the neonatology unit, the newborn nursery, and then the pediatric unit. And so we saw everything from difficulty with breathing, pneumonias, asthma problems, to snake bites, meningitis, and a little bit more severe cases. I learned a lot, but I, again, also had the opportunity to teach a lot, which walking in an environment like that, our first goal was to just meet people and get to know people and kind of learn their ways, because what they do it very well. I think it was after a couple weeks where we made friends, we made colleagues, that we were able to kind of pinpoint the places that we could help and how our knowledge would be able to help them long term instead of, an acute setting. So we got the opportunity to hold a couple different lectures, a couple different kind of like hands-on experience for both the nurses, the nursing students there, and then the physicians and COs or clinical officers, which are mid-level providers there, which you know, everyone on the team is such a vital part that it was really great being able to teach and work with all different levels. And then the community work itself was kind of a whole separate entity, yet integrated as one. One of the things we did was go out into the more rural areas and teach about new equipment that CMMB provided, a CPAP machine for neonatal resuscitation.
Oh, wow.
But then we also were able to break it down and just go over proper neonatal resuscitation because the infant mortality is very high in the area. A lot of the time because of lack of training and just not enough hands and people who know the actual protocol. So through Authority Health, we're able to continue the program Helping Babies Breathe and continue teaching those tools and that knowledge that will hopefully last a lot longer than we were there.
All right, great. So you did a lot of teachings, you left knowledge there, but it sounds like first you started off by respecting the knowledge that they already had.
Absolutely, absolutely. Yeah. I think sometimes one of the downfalls to medical mission work is that it's more for the people that are volunteering and kind of makes them feel good. But I think one thing that I respect about Authority Health is that when volunteering, it's never about the volunteers, it's always about who you're helping. And, you know, we can assume everything that we think is good, you know, being from the United States, but there were so many things that they were able to teach us that they do better, that they do that works, and respecting their, you know, their lives, the way they do their careers, and respecting their knowledge was first and foremost.
So you saw over 400 children, so you actually did hands-on medicine there. What were some of the things that you saw and the things that you were able to do in the treatment modalities?
Yeah, so as you can assume, a lot more limited from resources in there, even in the hospital, compared to kind of anywhere in the United States. One of the main things I noticed is that a lot of the time we do a lot of labs, we do a lot of imaging here, and that is not something that they are able to do all the time. Sure. It really helped my clinical skills because it made me kind of examine the patient and, you know, talk about the patient's progression instead of just relying on numbers on a computer through a lab or looking at imaging. You know, as I said, you know, we had snake bites. I've never worked with anti-venom before, but they have it and it's useful and they know exactly how to administer it. A lot of kids with dehydration, sepsis, bacterial infections in their blood, and so for them, we don't have a PICU and a ventilator backup to help them, and so it was a lot of monitoring, a lot of going back and being with the patients. Choosing the correct antibiotics was always difficult because we didn't always have the correct antibiotics. So it was a lot of conversation with the parents on, you know, how comfortable they felt. Shared decision making was definitely key there. Working with the nurses, helping them help us on what decisions to make based off of what resources we had. So it was definitely a learning curve, but I hope at least that we saved a lot of kids. I think one of the areas that I felt most useful again was the neonatal resuscitation. With all the skills we've learned at Authority Health and at Children's Hospital of Michigan, where the pediatric program mainly trains, we were able to take those neonatal resuscitation skills and help a lot of babies that otherwise may not have made it.
And one of the things that you mentioned that I know is going to be particularly helpful throughout your career is that shared decision making.
Absolutely.
You'll appreciate that, and the patient, which is the parent as well, certainly will appreciate you being skilled in the shared decision making.
Absolutely, and I think Authority Health has taught us to have those communicative skills when talking about someone's health and their health journey, and that's something that was emphasized over there because, you know, not speaking the same language, we had to come to an agreement that everyone understood even as a physician, I wanted
Yes.
to understand where the parents were coming from and vice versa.
Now, I understand there was an outbreak while you were there. Was it measles?
Yes, there was a measles outbreak,
Yeah.
which was not something obviously that we were expecting.
Right.
I had the opportunity to actually sit in on a health council meeting by Kenyan's national health government. Again, even though it was about a 3-hour meeting, the first 30 minutes to an hour, I kind of stayed quiet and took everything in. There was people from a lot of different organizations, UNICEF, Red Cross, different religious communities. One of the things there is just lack of education, lack of distribution of education, and so it was a lot of kind of coming up with plans and strategy on how exactly to give this education, because a pamphlet, someone coming in and doing a 20-minute lecture doesn't always touch those people.
Right.
There's a lot of medical mistrust especially with people survive so long without medicine and they never go to the doctor. So it's how do we reach people where they are?
I take it there's not then a lot of immunization.
No, exactly, right.
Yeah.
So a different set of immunizations over there, but we do obviously recommend very similar ones. We recommend that children get immunized, but with so many children and families living away from medical communities, they never have access to getting just simple immunizations and vaccines. And so it was a really eye-opening meeting about how we can help, and I was able to hopefully be helpful in kind of explaining and educating people on how to understand what immunizations are and how it's going to help long-term and widely. Mm-hmm.
Was there the same level of suspicion about immunizations that we have here, which I'm always still very amazed about?
Yeah.
But did you notice that there were suspicions around it, that it was going to cause the actual disease, or that it was some kind of conspiracy?
Yeah, that's a beautiful question, actually. A lot of people blame medical mistrust and suspicion on, all the, the internet, the social media, people talking to friends. But I think over there it was just as pertinent to see that medical mistrust and the suspicion against immunizations, more so from a religious standpoint, actually, from their perspective.
Mm-hmm.
They are people of very strong faith, the majority of the country, and they kind of rely on, God to help them through a lot of medical diseases, as they have watched and seen their relatives. Mm-hmm. So, I don't think it matters whether they had access to a computer or not. I think people just want to feel involved in their health journey. Yeah. And I think when someone is telling them what to do and they're not involved and they don't get to know all the details, it would make anyone kind of wary of the decision.
For sure. Yeah, excellent point. So we are speaking to Dr. Motzel. She's a pediatric resident here at Authority Health. She recently completed her rotation in Kenya, and we've been talking about it. What an amazing experience. So if you or someone you know needs a pediatrician, which is very important, please visit the Anne Murray Ice Pediatric Health Center, and the phone number is 824-1000, and then when asked, choose prompt number 3. Again, that's the Anne Murray Ice Pediatric Health Center. The phone number is 824-1000, and it's prompt number 3. So I know our time is getting close and coming to an end, but I think you've described this as a transformational experience for you. And I always love that word, transformational, because, it's just, bigger and better than just, it was really great, all of that. So when I hear someone describe their experience as being transformational, I'm always interested in hearing a little bit more about that. So
absolutely.
If you can unpack that a little for us.
Yeah, absolutely. I've been interested in medical missions my whole life. I had the opportunity to go to Nicaragua, Mexico, but I think through Authority Health and CMMB, having this very unique experience as a physician, as a resident now, I was expecting to learn a lot of medicine, right? That was kind of what it was billed as. You're going to go and you're going to help a lot of people in their medical journey. You're going to learn a lot clinically. You're going to be able to teach. But I think it was really transformational, because I came out not only feeling confident in my clinical skills, but recognizing the difference it made in me as a person.
Yeah.
I think one of their emphasis is the always helping people, and they take that to a different level. We got a flat tire on the side of the road, and no less than 20 people physically stopped their car, came out to help us. And I think everyone always asked me what the best part of it was. We had the opportunity, of course, to go on safari after our time at the hospital, but it wasn't the animals. They were beautiful. It wasn't, the views that we saw.
Right.
The best part of my time there was the people and how they really emphasize being together. And I'm a better person because of them.
Wow. Well, that is a great place to stop. I just want to say that from the discussion that you've had with us, I can envision that this global experience is really going to fit with you and be something that you can carry on into your practice plans as you become a fabulous physician, as you are right now, treating patients in rural or urban areas where there's resource constraints and where you actually have to understand the people and touch them in a very special way. We are very proud to have you in our residency program. You're close to graduation.
I am.
So you're going to just go out and take the world by storm.
Thank you.
And we're very proud of you. Well, once again, knowledge is power, and in this segment, we wanted you to understand more about the work that's going on here at Authority Health through our residency program that really trains physicians to work in resource-constrained communities and to really understand the social determinants of health and the community that we serve. We will see you next time.